Hello, I'm Dr. Naeem, and welcome to MedWise by Dr. Naeem. Today, we're diving into psoriasis, a chronic skin condition that can affect children and cause discomfort for families. I'll cover its types, the anatomy and physiology of skin, causes, signs and symptoms, diagnosis, treatments, and home remedies to help manage psoriasis in kids. Let's get started. What is psoriasis? Psoriasis is a chronic autoimmune skin condition causing red, scaly patches due to rapid skin cell turnover. It affects about 1 to 3% of children globally, often starting in childhood or adolescence. While there's no cure, proper management reduces symptoms, improves quality of life, and prevents complications like infections or joint issues. Types of psoriasis in children: plaque psoriasis, most common, with red, scaly patches, plaques, on elbows, knees, scalp, or lower back. Guttate psoriasis, common in children, with small, drop-shaped spots, often triggered by infections like strep throat. Inverse psoriasis, smooth, red patches in skin folds, for example, armpits, groin. Pustular psoriasis, rare, with pus-filled blisters surrounded by red skin. Erythroderma psoriasis, very rare in children, widespread redness and scaling, requiring urgent care. Psoriatic arthritis, joint pain with skin symptoms, affecting some children. Anatomy and physiology of skin in psoriasis. Psoriasis alters the skin structure and function. Anatomy: the epidermis, outer layer, contains the stratum carinum, a protective barrier of dead cells and lipids. The dermis holds blood vessels, nerves, and immune cells. Children's skin is thinner, increasing sensitivity to inflammation. Physiology: normally, skin cells renew every 28 to 30 days. In psoriasis, T cells mistakenly attack healthy skin, speeding turnover to 3 to 7 days. This causes keratinocyte hyperproliferation, forming thick, scaly plaques. Cytokines, for example, TNF-alpha, IL-17, IL-23, drive inflammation, causing redness and itching. Scratching or injury, Koebner phenomenon, triggers new lesions. In children, the immune system's heightened response amplifies flares, especially after infections. Causes: psoriasis in children stems from genetic, immune, and environmental factors. Genetic, family history increases risk. HLA-CW6 gene is strongly linked. 30% of children with psoriasis have a close relative affected. Immune, autoimmune dysfunction, with overactive T cells attacking skin. Environmental triggers, infections, for example, streptococcal throat infections for guttate psoriasis. Stress, cold weather, or skin trauma, for example, cuts, sunburn. Medications, for example, beta blockers, antimalarial. Lifestyle factors, poor diet, obesity, or exposure to irritants like harsh soaps. Child-specific triggers, vaccinations, teething, or school-related stress. Signs and symptoms. Psoriasis symptoms in children vary. Infants, 0 to 2 years, rare but may present as diaper area rashes or scalp scaling. Young children, 2 to 12 years, red, scaly plaques on elbows, knees, or scalp. Itching or burning, disrupting sleep or school. Guttate spots after infections. Adolescents, 12 to 18, plaques or nail changes, pitting, thickening. Joint pain and psoriatic arthritis. Complications: secondary infections from scratching. Emotional impact: low self-esteem or anxiety due to visible lesions. Note: symptoms may mimic eczema, requiring careful diagnosis. Diagnosing psoriasis in children is clinical, with tests for confirmation, clinical assessment, history, onset, family history, triggers, or recent infections. Physical exam: silvery white scales, Auspitz sign, pinpoint bleeding when scales are removed, or nail pitting. Tests, if needed: skin biopsy, confirms psoriasis in atypical cases, showing epidermal thickening. Throat swab, detects streptococcal infection and guttate psoriasis. Blood tests, rule out arthritis, for example, rheumatoid factor, or inflammation markers. Challenges: misdiagnosis as eczema, fungal infections, or seborrheic dermatitis is common. Action: persistent or worsening rashes need a dermatologist's evaluation. Treatments: standard treatments reduce inflammation, slow skin turnover, and manage symptoms. Medical treatments: topical therapies, corticosteroids, low potency, hydrocortisone, for face, moderate, betamethasone, for body, used 1 to 2 weeks to avoid side effects. Vitamin D analogs, calcitriol to slow cell growth. Calcineurin inhibitors, tacrolimus for sensitive areas, for example, face. Phototherapy, narrowband UVB for widespread psoriasis, used cautiously in children greater than 6 years. Systemic therapies, severe cases, methotrexate, cyclosporin, or biologics, for example, Intercept, adalimumab, targeting TNF-alpha or IL-17, under specialist supervision. Antihistamines, cetirizine to relieve itching. Antibiotics, for secondary infections or strep-triggered guttate psoriasis. Supportive care, emollients, petroleum jelly or thick creams applied 2 to 3 times daily to reduce scaling. Trigger avoidance, stress management or infection control. Counseling for emotional impact, especially in school-aged children. Note, treatments are tailored to children's age and severity to minimize side effects. Home remedies. These remedies support psoriasis management for families. Moisturizing baths. Soak in lukewarm water with 1 cup colloidal oatmeal for 10 minutes daily to soothe skin. Aloe vera. Apply pure gel to plaques twice daily to reduce redness. Coconut oil. Use 1 teaspoon on affected areas for hydration and scale softening. Epsom salt bath. Add ½ cup to bath water for 15 minutes to ease inflammation. Cotton clothing. Dress children in loose, 100% cotton to prevent irritation. Sun exposure, brief, controlled exposure, 5 to 10 minutes daily, to promote vitamin D and reduce plaques. Omega-3 foods, include fish or flax seeds in diet to reduce inflammation. Stress management, encourage relaxation techniques, for example, storytelling, for kids. Caution, test remedies on a small area, consult a doctor if irritation or infection occurs. Most affected gender. Psoriasis affects both genders equally in children. No gender bias. Genetic and immune factors drive prevalence, not sex. Social impact. Visible plaques may lower confidence, with girls potentially facing more appearance-related concerns. Management focus. Skincare and emotional support are key for all children. Impact across age groups. Focus on children. Psoriasis primarily affects children. Infants, 0 to 2 years. Rare, often mild diaper or scalp involvement. Young children, 2 to 12 years, plaques or guttate lesions impact school and social life. Adolescents, 12 to 18, persistent cases or arthritis affect self-esteem and activities. Global data, psoriasis affects 1 to 3% of children worldwide, with urban areas seeing higher rates due to stress and pollution. Outcome, many children experience remission with treatment, though some have lifelong flares. Psoriasis in children can be tough, but with early diagnosis, treatments like topical corticosteroids and biologics, and home remedies such as aloe vera and coconut oil, you can manage symptoms effectively. If you found this helpful, like, subscribe, and share for more insights on MedWise by Dr. Naeem. Comment below, what's your psoriasis tip for kids? Stay healthy.